Please note this video was filmed during the COVID-19 pandemic. For the latest maternity service advice and information about COVID-19, please visit our dedicated site at www.mtw.nhs.uk/COVID-19 maternity information. Labour can be an intense experience, and as well as being different for everybody, each labour that each individual has will be different, so it's important to keep an open mind. Here at MTW, we have a vast array of ways that we can help you deal with the pain of labour. In this video, we will tell you about all the options that we have and the risks and benefits of each one. For the purpose of this video, we will use the words pain and contraction. We are aware that those who are using hypnobirthing techniques prefer to use the word surge and wish to avoid all reference to the word pain. If you're using hypnobirthing techniques in your labour, please put this into your birth plan so we can ensure that we are using your preferred terminology. Hypnobirthing combines breathing techniques, mindfulness, relaxation and visualization to help you concentrate on your body and the birth of your baby. You and your birth partner can learn practical techniques to help you feel confident to make decisions together about your labour. Hypnobirthing can be used with all forms of pain relief at any stage of your labour and wherever it is that you are having your baby. Now, some expectant parents will attend private hypnobirthing classes, but you don't have to. You can teach yourself a lot of the techniques from books or CDs, audio tracks, podcasts, or by looking at websites. Please speak to your midwife or check our website for details about our private hypnobirthing classes that we run at Crowborough and Maidstone birth centres. One of our community midwives, Grenier Rose, is now going to talk to you a little bit about breathing techniques that can help reduce feelings of anxiety in labour.
A lot of people enter labour and they're fearful. And if you're fearful about anything at all, your body produces a huge surge of the hormone adrenaline, which is the fight-flight response hormone. When adrenaline is high, your muscles are tense, your blood pressure is up, your pulse is high, and all your blood goes to your legs and your arms so that your body is ready to run from whatever it's frightened of or fight it. And consequently, you've got no blood flow around your middle, which is where you need it for labour. When you're relaxed, and the oxytocin hormone, which is the labour hormone that is necessary, is high, your heart rate is steady, your blood pressure is low, your breathing is deep and steady, and your muscles are loose and relaxed. So the crux of this is for you to get your breathing right. And it sounds terribly simple. Practice in the pregnancy breathing exercises. And this is just about breathing in through your nose for a count of 3 or maybe 4, and out through your mouth for a count of 5, 6 or maybe 7, but whatever is comfortable for you. So it's just a I want you doing that 5 or 6 times each and every day so that you get into the habit of it. And when labour starts and your tightenings arrive and then your contractions arrive and the surges, then you just naturally click into that breathing technique.
Another great method of pain relief that you can use in labour is water. We know from just general life, if you're feeling quite stressed or you're uncomfortable, getting in a nice warm bath is a really nice way to relax. This is because water creates weightlessness. It increases your ability to move around and be more upright and mobile to help baby descend into the pelvis. We also know that heat is really good for pain. Think about things like deep heat cream, or if we hit ourselves, we rub it to create heat because that really helps relieve pain. We recommend that pools be around 37 degrees, so around body temperature, which is just right to help you relax in labour. You can use water at wherever you plan to have your baby. If you're coming to one of our birth centres or to Tunbridge Wells Hospital, we have some lovely birth pools for you to use. If you're planning on having your baby at home, you can talk to your midwife about where you can hire an inflatable birth pool to use in your house, or you can use your bath if you have one. There is some evidence to suggest that being in water for your labour can help increase your chance of having a vaginal birth, can help increase feelings of relaxation and control over your experience, and can also sometimes decrease the length of your labour. As well as there being plenty of benefits to being in water for your labour, there are also benefits to being in water for the birth of your baby as well. So if you'd like to stay for the whole thing, then that's absolutely fine. There's no evidence to suggest of any negative outcomes for babies that are born in water compared to babies born on dry land. And if you would like to, then your birth partner can be in the pool with you as well during the birth, but that's completely up to you. When you're in labour, we listen regularly to your baby's heart rate, and if you're in water, then that can still be achieved. If we're listening into your baby intermittently, then our sonic aids are waterproof, so this can come in the water with you. Your midwife may just ask you to move ever so slightly, or possibly even stand up briefly from the pool, just so they can have a listen to baby's heart rate. If we have recommended that we listen into your baby continuously throughout labour with one of our CTG monitors, then Tunbridge Wells Hospital does have wireless telemetry monitors that are waterproof, so that can also come in the pool with you. When you're calling either the birth centre or Tunbridge Wells Hospital to say that you're in labour, please let the midwife know that you are intending to use a pool so they can start preparing it and filling it for you, ready for when you arrive. Grania is now going to talk a little bit about TENS.
TENS is trans-electrical nerve stimulation. It's a unit that you hire, and you can hire them from the Maidstone Birth Centre or Crowborough Birth Centre. It comes as a unit. All of them look slightly different, but they do the same thing so long as you've hired an obstetric TENS. There are 2 pairs of pads, and yours will be impregnated with a gel. They're single person pads, not single use. So when you put the pads on, you may well want to take them off and get in the bath and then put them on a little bit later. So long as you put the pads back on the Perspex sheet that they came with, then they're reusable for you. So you put 1 pair of pads either side of your spine below your bra line, and 1 pair of pads either side of your spine above your knicker line. It doesn't matter which pair go where. You then switch one of the dials, you switch it on and switch it up until you start feeling a pins and needles sensation. You switch it up a little bit further, and then you personally think, oh, I don't like that. Put it back to where it was comfortable. That's now set. You go to the second dial, you switch it on, you switch it up until you feel the pulse, the pins and needles sensation, switch it up a little bit more. When you don't like the sensation, put it back to where it was comfortable. Your TENS is now set, and you are in charge of your TENS, and you're the only person that changes the dials. The pins and needles sensation continues all the way through labour. When you have a contraction, you press the boost button, and the pins and needles sensation becomes a constant. At the end of the contraction, you release the boost button, and it goes back to a pulse. Put the TENS machine on as early as you like. It will help your body. It builds up natural endorphins over time. Your TENS machine can then stay on throughout the process of labour until after your baby's born.
Something else that we can offer you to help with the pain of labour is aromatherapy. Aromatherapy oils can be used in various ways. You can either have a few drops on a tissue that you can smell during labour, you can have some oils in a diffuser, or they can be used with a carrier oil and massaged into your skin. Some of these oils have very powerful properties and may not be suitable for you or your particular stage in pregnancy, so it's really important that you discuss what you're planning on using and how with a midwife or aromatherapist before using them. One of the most common oils that we use here is lavender. Lavender is a great all-rounder. It's very calming and relaxing, and it smells great. It's really nice put on a tissue or in a diffuser that you can smell anytime that you're feeling stressed or anxious. Another oil that we use here is clary sage. Now, clary sage is really great for stimulating labour and can really help if your labour has slowed down a little bit or to try and get contractions going. It's really nice, again, put in a carrier oil and massaged into your skin. Because of this effect that it can have on your contractions, it's really important that you avoid using this in early pregnancy. We have aromatherapy oils stocked in all of our places of birth, so both of our birth centres and at Tunbridge Wells Hospital. Some of our midwives are trained aromatherapists and can make up specific blends. So here we've got a relaxation blend and also a labour blend that have been mixed up by our midwives. Please speak to your midwife if you're interested in using any aromatherapy oils at any point during your pregnancy or labour. Another method we can use for pain relief in labour that doesn't involve giving drugs are sterile water injections. These injections are given with really small needles in the base of the spine and can really help relieve lower back pain in labour. This can be a really common place to feel discomfort during labour, so these really help. Now, you may think, water, that's not going to help me, but it really, really does. Quick and easy, and the effect can last for up to 2 hours. 2 midwives will identify specific points on the base of your spine and will give you injections on each side at the same time, so the effect is equal. It will sting for around 20 seconds as they first go in, but then the relief from the pain is almost instantaneous. Like all the other methods of pain relief we've spoken about in this video, because they don't involve using drugs, you can use them in combination with drugs. With sterile water for injections, you can continue to be mobile and move around during your labour, and you can have the injections as many times as you like. If there's anything in this video that you would like to discuss, then please contact your midwife.